Get ready for an insight that may change the way you think about your well-being. Routine exams can overlook the faintest red flags, and a quiet danger can hide behind everyday discomforts, a crafty opponent so hard to spot that many clinicians never link the scattered symptoms to their real origin. The condition in question is pancreatic cancer, often called the silent killer, because it advances with remarkable subtlety and typically comes to light only after it has progressed. Even so, your body does communicate, offering soft signals that, once you learn to notice them, could make all the difference. Far too often people shrug these warnings off, attributing them to stress, getting older, or simple indigestion. In truth, these small annoyances may be the pancreas's first calls for help. This is especially important because, unlike many cancers, there is no standard early screening test for the general public. Early recognition depends on your willingness to pay attention to subtle shifts and take decisive steps. Picture yourself spotting a threat this serious before the window closes. The goal is not only to cure it, is also to preserve quality of life, protect independence, and continue to share time with the people you love without the shadow of a devastating illness. Research from the National Cancer Institute indicates that, although pancreatic cancer is relatively uncommon, identifying it early can increase the 5-year survival rate by 20%. The number may look modest, yet it translates into lives preserved and narratives transformed. So, what are the hidden indicators? Why do they so easily escape notice? And how can you become your own strongest advocate by recognizing them and responding? Stay with us as we explore 8 unexpected symptoms of pancreatic cancer that few people anticipate. If what you hear is helpful, support this work, tap, like, share it with someone who could benefit, and subscribe to be part of our community devoted to energetic, intentional aging. Tell me in the comments which city you are watching from and how old you are. I love reading your experiences and connecting with each of you. Watch through to the end because the final sign is truly the most surprising and the most underestimated. You will not want to miss it. 1. Depression, anxiety, and unexplained mood changes. This final indicator is often the most unexpected and the most heartbreaking, because it can slip past even experienced clinicians, dismissed as ordinary mental health trouble or everyday stress. The sudden emergence of severe unexplained depression, mounting anxiety, or stark changes in mood, particularly in someone without a prior psychiatric history, can appear early in pancreatic cancer. This isn't a fleeting low mood. It looks like profound depression, persistent apathy, difficulty concentrating, marked irritability, or a total loss of interest in activities that once brought joy. The mechanism isn't fully clear. Pancreatic tumors may release substances that influence brain chemistry, or the illness's physical burden, and stress may drive these shifts. Picture being weighed down by deep sadness without a clear cause, or living with relentless worry that disrupts daily functioning. The Pancreatic Cancer Action Network has underscored depression as an unusual yet meaningful symptom reported by many patients with pancreatic cancer. If you or someone close to you develops a dramatic, persistent change in mood or personality, with no obvious explanation, don't label it as just depression. It may be the body's alarm. Mind and body are inseparable, and physical disease can surface through psychological signs. If this connection resonates most strongly, write a mind-body connection in the comments. 2. Unexplained blood clots, deep vein thrombosis. Here's a sign so unexpected that few people would ever connect it to cancer, let alone pancreatic cancer blood clots, particularly in the deep veins of the legs, deep vein thrombosis, or DVT, or clots that travel to the lungs, pulmonary embolism. DVT typically presents with swelling, pain, and redness in one leg. A pulmonary embolism may bring sudden shortness of breath, chest pain, and coughing. In certain cases, repeated or unprovoked clots are the very first and only hint of an underlying pancreatic tumor. The link exists because pancreatic cancers, like many malignancies, create a hypercoagulable state. Tumor cells can release factors that switch on the body's clotting pathways. Picture being generally active and well, then developing a clot without a long flight, recent surgery, or prolonged bed rest. Research from the Mayo Clinic indicates that an unprovoked DVT should trigger a thorough search for hidden causes with pancreatic cancer among the possibilities to keep on the radar. If you've experienced a clot without an obvious reason, especially alongside other signs on this list, pursue a full evaluation. This is a serious warning, a genuine red flag. If this surprised you, write clots alert in the comments. 3. Abdominal or back pain that radiates. Pain shows up in many cancers, but its pattern in pancreatic disease is tricky and often late to be recognized. The discomfort is usually a dull, steady ache in the upper abdomen, just beneath the ribs that tracks through to the back. It may intensify after eating, or when lying flat, and feel a bit better when you lean forward. The driver is pressure on nearby nerves or organs, or in some cases direct invasion. As a tumor enlarges, the pain tends to grow more persistent and more intense. Early on, it can come and go, making it easy to brush off as a strained muscle or simple indigestion, particularly in older adults. Back pain is so common that the link is frequently overlooked. Think about pain that ignores rest and ordinary painkillers that breaks your sleep or interferes with daily routines. If it settles between the shoulder blades or along the bra line in women without a clear musculoskeletal or spinal explanation, it deserves investigation. Do not minimize ongoing pain, even if it starts out mild. Pay attention to what your body is telling you. If you have ever dealt with unexplained pain that prompted a medical visit, share your experience. 4. A new diabetes diagnosis or a sudden worsening. One of the most unexpected and least recognized red flags of pancreatic cancer is the sudden onset of diabetes, or a rapid deterioration of blood sugar control in someone who was previously stable. The pancreas is the organ that makes insulin, the hormone that keeps glucose in check. When a tumor disrupts insulin-producing cells or undermines their function, blood sugar can spike, prompting abrupt increases in medication needs, or in someone with no prior history of diabetes, an unexpected high glucose reading during routine labs without any clear lifestyle explanation. Research cited by the American Diabetes Association reports that up to 80% of people with pancreatic cancer either develop diabetes or experience a marked worsening before the cancer is identified. The impact isn't limited to insulin production. Tumors may also release factors that drive insulin resistance. If you notice intense thirst, frequent urination, profound fatigue, or blurry vision, without another cause, especially in the setting of a new diabetes label, pursue an urgent pancreas-centered evaluation. Elevated sugar alone isn't the whole story. It may point to something far more serious. If this link surprised you, write pancreatic diabetes in the comments. 5. Persistent indigestion and changes in stools. Almost everyone deals with indigestion now and then, but when it becomes a constant companion that shrugs off antacids and routine diet tweaks, it's time to be alert. We're talking about heaviness after meals, bloating, excessive gas, repeating waves of nausea, and at times vomiting symptoms, often mislabeled as reflux gastritis or irritable bowel syndrome. In the setting of pancreatic cancer, these problems can stem from a tumor that narrows the pathway for food or, more critically, prevents pancreatic enzymes from reaching the intestine. Without those enzymes to break down fat, stools develop very distinctive features. Instead of normal appearance, they may turn pale and greasy, become bulky, difficult to flush, and carrying an especially strong, unpleasant odor because food remains partially undigested. You might also see unexplained ongoing diarrhea or stubborn constipation, think chronic loose stools, without a clear trigger or constipation that ignores standard laxatives. The World Health Organization emphasizes that persistent indigestion, particularly when paired with weight loss or jaundice, warrants comprehensive evaluation. Do not settle for a surface-level label of dyspepsia if your symptoms fail to improve. Your digestive tract reflects what's happening inside. If you've dealt with long-standing digestive troubles, share what you experienced and the guidance you were given so others can learn from your story. 6. Unexplained changes in appetite and weight loss. This sign looks straightforward, yet carries hidden layers that allow it to go unnoticed. Loss of appetite and unintentional weight loss are frequent in pancreatic cancer, but they're seldom linked to it at the outset. Many people, particularly older adults, chalk up a few lost pounds to aging stress or mild stomach upset. This, however, is not routine slimming. We're talking about a meaningful decline over 5% to 10% of your body weight within 6 to 12 months, without dieting or exercising more. Several forces drive it. Cancer demands enormous energy. A pancreas that isn't functioning well may produce too few digestive enzymes, impairing absorption of nutrients and setting the stage for quiet malnutrition. A growing mass can also press against the stomach or the duodenum, leading to early fullness or post-meal nausea, which further suppresses intake. Picture feeling completely satisfied after just a few bites or suddenly turning away from foods you once loved. Layer on a heavy fatigue that rest doesn't fix a drained, sluggish feeling that makes even simple chores exhausting. If your clothes start hanging loose without any effort or meals, no longer appeal the way they used to treat it as a serious alert. Don't dismiss it as just aging. Your body is signaling that something foundational is wrong. If you've ever shed weight without trying, tell me in the comments how much you lost and what you believed was behind it at the time. 7. Inexplicable and persistent itching. Here's a warning sign few people associate with pancreatic cancer, which is precisely why it slips under the radar: widespread itching with no clear cause. This isn't the occasional dryness of winter skin, a flare from allergies, or the aftermath of bug bites. It's a diffuse body-wide itch, often without a visible rash, that shrugs off moisturizers and doesn't settle with typical antihistamines. The driver is the accumulation of bilirubin in the skin, the same pigment responsible for jaundice. When bile flow is blocked, metabolic byproducts build up in the blood and deposit in skin tissues, triggering relentless irritation. Picture a constant itch that interrupts sleep, intrudes on your day, and initially defies any simple explanation. It's frequently mistaken for a trivial dermatologic issue, which can postpone recognition of the underlying disease. This sensation may be especially intense on the palms and soles, though any area can be affected. If you're dealing with unexplained itching that persists for weeks or months and fails to respond to standard remedies, particularly when it appears alongside other signs, we're discussing seek a comprehensive medical evaluation rather than settling for surface-level relief. Your body is sending a message even through an unusual symptom like this. If this insight surprised you, drop a comment with a scratching emoji to let me know it resonated. 8. Jaundice. That yellowish cast doesn't stop at the skin. When people think of jaundice, they imagine skin and eyes turning bright lemon yellow, and that can happen, but in the early phases of pancreatic cancer, the change may be far more muted, almost easy to miss. Instead of a vivid color shift, you might first notice a faint golden tint in the whites of the eyes, or a slightly sallow, tired-looking complexion that could be mistaken for poor sleep or simple fatigue. The reason is mechanical. A mass commonly at the head of the pancreas can obstruct the bile duct, preventing bile from flowing into the intestine and allowing bilirubin, the bile pigment, to accumulate in the bloodstream. Jaundice is more than a skin finding, so train your eye for two quieter clues: dark urine and pale stools. Picture urine turning deep brown, like strong tea. Even when you're well hydrated, this reflects bilirubin being filtered out by the kidneys. If your stools, instead of appearing brown, shift to light gray-pale or clay-colored and tend to look greasy or float, that's another pivotal sign. It suggests that bile and pancreatic enzymes aren't reaching the gut to break down fat-leaving stools oily with an unusually pungent odor. Research from the American Cancer Society points out that dark urine is sometimes the very first sign of jaundice people notice even before any yellowing of the skin is obvious. Don't brush off these changes, no matter how slight. If this caught you off guard, write "I never thought of that" in the comments and share whether you've seen any of these shifts in yourself or someone close to you. Awareness is where protection begins. Dear friends of healthy care, We've walked through 8 warning signs that, though unexpected, can be crucial for spotting pancreatic cancer early. From faint changes in skin tone and stool appearance to unintentional weight loss and stubborn digestive troubles. From new onset diabetes to pain that spreads to the back, unexplained clots, and striking shifts in mood, each one by itself might look minor. But when persistent or appearing together, they are your body's way of asking for attention. Our goal isn't to alarm you, it's to equip you. The essential skill is to listen and refuse to dismiss what your body is communicating. If you notice one or more of these signs continuing, or if your instincts say something is off, see a healthcare professional right away. And if the first assessment doesn't feel right, seeking a second opinion is absolutely reasonable. Your health is your most valuable asset, and you are its first line of defense. This learning journey continues with your help. If this video clarified something or taught you a new insight, please support the channel tap, like share it with family and friends, especially those over 50, and subscribe so we can keep growing a community that prioritizes informed, healthy living. Together, we can reach more people, bringing reliable guidance where it's needed most. Remember, prevention and early recognition are powerful. The choices you make today can shape a healthier, fuller tomorrow. Now that you're familiar with these 8 lesser-known symptoms, you're better prepared to safeguard yourself and those you love. If you made it all the way to the end, drop the number 8 in the comments. That tells me you're committed to your health and that this information matters to you.